Chapter. Other pharmacy environments. Key terms. Mail order pharmacies. Pharmacies that send medications to patients through mail or other delivery services. Although they may offer all the services of a community pharmacy, they specialize in providing maintenance medications used to treat chronic conditions. Acute condition. A sudden condition, such as a sudden infection, requiring immediate treatment. Chronic condition. A continuing condition that requires ongoing treatment for a prolonged period of time, such as diabetes, high blood pressure, etc. Maintenance medication. A medication that is required on a continuing basis for the treatment of a chronic condition. Long-term care pharmacy organization. A licensed professional pharmacy, or practice that provides medications and clinical services to long-term care facilities and their residents. Long-term care facilities. Facilities that provide care for people unable to care for themselves due to mental or physical impairments. These facilities include nursing homes, psychiatric institutions, chronic disease management facilities, and rehabilitation facilities. Patients of long-term care facilities are referred to as residents. Distributive Pharmacist. A long-term care pharmacist responsible for making sure long-term care patients receive the correct medications ordered. This job is mainly done outside of the long-term care facility itself. Consultant Pharmacist. A long-term care pharmacist who develops and maintains an individual pharmaceutical plan for each long-term care resident. Home health care. Care provided in a patient's home that might otherwise be provided in an institutional setting or physician's office. Home care agencies. Home nursing care businesses that provide a range of health care services, including infusion. Home infusion. Intravenous administration of various types of infusions that take place in a patient's home. Home infusion pharmacies. Specialized pharmacies that prepare admixtures, provide infusion pumps, and are involved in various aspects of the patient's care plan. Many hospitals offer home infusion therapies as a way to ensure continued therapy after patients are discharged. Infusion pumps. Pumps that control infusion for specific therapies, or multiple therapies, as well as ambulatory pumps that can be worn by the patients. Primary home infusion therapies include anti-infective therapy, parenteral nutrition, pain management, and chemotherapy. Anti-infective therapy. Infusions of antiviral, antibiotic, and antifungal therapies to treat AIDS-related and other infections, especially in patients with compromised immune systems. Parenteral nutrition. Nutrient-supplying infusions for patients with various intestinal disorders. Pain management. Infusions of narcotics for patients with painful terminal illnesses, or other types of severe chronic pain. Chemotherapy. Under certain conditions, chemotherapy can be provided in the home, in conjunction with an oncology program, at a hospital or clinic. Nuclear pharmacy. Specially licensed and regulated pharmacies that prepare radioactive materials called radiopharmaceuticals, used for diagnosis and treatment of diseases. Compounding community pharmacies. Specialize in compounding services, but may also fill prescriptions for commercially available products, and/or sell some over-the-counter products, sometimes called hybrid pharmacies. Key concepts. Mail order pharmacy. Mail order pharmacy is used for maintenance therapy for such chronic conditions as depression, gastrointestinal disorders, heart disease, hypertension, and diabetes. Mail order pharmacies must follow federal and state requirements in processing prescriptions, but are not necessarily licensed in each state to which they send medications. Mail order pharmacies are generally large-scale operations that are highly automated. Pharmacists review mail order prescriptions before and after filling. Long-term care. Facilities that provide care for people unable to care for themselves because of mental or physical impairment. Most long-term care facilities will contract out dispensing and clinical pharmacy services. Home health care. Home health care is supervised by a registered nurse who works with a physician, pharmacist, and others to administer a care plan that involves the patient or another caregiver. The fastest growing area of home health care is home infusion. Infusion pumps are available for specific therapies, or multiple therapies, and include ambulatory pumps that can be worn by patients. In home infusion, the patient or caregiver is educated about the therapy, how to self-administer, monitor, report problems, and so on. The primary therapies provided by home infusion services are antibiotic therapy, parenteral nutrition, pain management, and chemotherapy. The same rules apply to preparing parenteral admixtures in the home setting as in the hospital. Nuclear pharmacy. Nuclear pharmacies prepare radiopharmaceuticals that are used for diagnosis and treatment of diseases. Nuclear pharmacies are typically located for easy access to hospitals and clinics where diagnostic testing is performed. Radiation safety is regulated on the federal level by the Nuclear Regulatory Commission or NRC, and the Department of Transportation or DOT. Compounding community pharmacies. Approximately 7,500 pharmacies in the United States specialize in compounding. Compounding pharmacies are regulated by state boards, the FDA, the DEA, and can additionally seek accreditation.